Greetings and welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have an awesome spotlight session and an update from Leslie Ballard from the North Oaks Medical Center Dietetic Internship. She's invited one of her new interns and one of my former students, Carolyn Reed, to tell us all about her experience, and I've also invited some of my current students to ask their questions of the program. Check it out. All right, welcome back to the podcast, Leslie. To get us started, let's give our new viewers a little bit of an introduction to you, and then I would love for you to jump in and tell us about some program updates with North Oaks.
Sure. Well, I am Leslie Ballard. I'm the program director of the Dietetic Internship here at North Oaks Medical Center in Hammond. I know hopefully most of you watched the first version of our podcast, so I can give you just some brief updates today. I'll also have one of my current interns with us, and she can tell you a little bit about the program from an intern's perspective, as well as hopefully answer some questions if any viewers have questions. And I'll just jump right into some updates that we have. What I wanted to do for this podcast was just really give you a great idea of what a day in the life of an intern is actually all about. So as we go through this, you see the very first thing that we do, I have the new interns come to the graduation of our outgoing students. I do that for a couple of reasons. One, so that they know that they will too be at graduation before they know it, but also for them to be able to meet each other before they're sitting in orientation, to be able to meet the outgoing students and ask them questions about how to best prepare for the internship. So this is just like a little picture of us at graduation this past year, some of the interning incoming students. Then our onboarding process begins. So incoming interns are onboarded to the hospital just like an employee would be. So they do go through a drug screen, they do go through a background screen, they have to have an employee physical, vaccinations, everything that a normal hospital employee would require. And then they begin 2 days of general hospital orientation with all the other new employees of the hospital. From there, they have 2 days of internship orientation with me, where we go through your schedule, what every day-to-day aspect of the internship is going to look like. And then they also have 3 days of an MNT orientation with our clinical dietitian manager to jumpstart them before they start MNT rotations. And she practices all of your calculations, all of those things that students might be a little bit rusty on. Okay, so what I'd like to show you now is an example of what the actual intern schedule looks like. So you're a new intern, you come day one, it's orientation with me, everyone gets their schedule for the whole year. And I'd like to show you that. So this is just an example just to show you, I have the schedule created for the year. So you can see all 9 of my interns and everyone knows where they're gonna be from day one until graduation. They can see if they're going to be with another intern at a rotation or if they're going to be by themselves. And there's a key that goes along with this rotation schedule so that they know, okay, I'm going to be with Chrissy on this day. Here's Chrissy's phone number, her email. This is how I contact her. This is how I set up my rotation. So all the interns get this on day one, so they know not only where they're going to be, but if they're going to be with another intern at a rotation site. This, I think, puts everybody's mind at ease a little bit. Not to say that there's not some changes that happen throughout the year. Hello, we had a hurricane this year and put us off for 2 weeks. Those things happen and we roll with it. But this does give the students kind of an idea of what they're going to be looking at as the year goes on. So I just wanted to share that with you. So after our interns finish their orientation with me, they jump right into their rotations. So some students are going to start with clinical rotations, others might start in food service or community. If they're going to start in clinicals, they're going to go with that 1 week MNT orientation first with Katie, who's our clinical manager, who you see pictured here in pink. The students work one-on-one with their preceptor. So it's one intern to one dietitian for MNT. They are with each dietitian for roughly 2 weeks before switching to the next, and they spend about 12 weeks here at North Oaks before we send them out to other hospitals for rotation sites. So they might be going to UMC burn unit, but they're not going to go there until they've completed all of their MNT here first. Clinical assignments, they do case studies, diet education handouts, research papers on oncology and renal nutrition. We practice physical exams, ethics, and trauma rounds. So there is some assignments that go along outside of your general rotations. A lot of that can be worked on here, but it is homework based. Other clinical rotations, so besides the rotations they do here, after they complete staff relief at North Oaks, they're going to go out to other rotation sites. Other clinical experiences, we go to Lally Kemp, we go to University Medical Center, St. Tammany Cancer Center, and dialysis centers. Some students will start with food service management. If they don't start there, they will end there. In food service management, that is also done primarily here at North Oaks with our food service team. And you can see them there with hairnets and gloves in the kitchen doing exactly what you would expect to do in food service. We do have a fairly large facility, so we are feeding lots of patients and employees and guests, so it is a pretty well-oiled machine. Some assignments that go along with that, we have menus, they'll do sanitation checks in the kitchen, they'll work with the supervisors, we'll do patient satisfaction surveys, and services to the employees, and it all culminates in a theme day assignment where the student basically takes over the menu for the day to plan, order, prepare, and serve food. We have some community events and rotations as well. Here pictured is at our fueling station at Southeastern with their athletics department. Other rotations, we've got, of course, sports nutrition, WIC, outpatient counseling, both here at North Oaks and at Baton Rouge General, bariatrics at Cypress Point, and the surgical specialist of Louisiana. We do child nutrition with the school board, and the students get to do a choice rotation, which is 3 weeks, where they can basically pick their dream job, and we get them set up with a dietitian there to do a rotation of their choice. We do class once a month. So with the way the schedule works, sometimes students are out for weeks at a time in community rotations or other hospitals, and they might not be here on campus. So having monthly class is a way for me to get everybody in one room together, so that I can check in with everyone and they can check in with each other and fill each other in on what the rotation sites are like for other students who haven't been there yet. In this monthly class picture, it was taught by some nurses here at North Oaks, and they were teaching the students how to do manual blood pressure checks and glucometer checks, and talking about blood sugar and how patients check their blood sugar at home with glucometers. Other topics that we might have during class, I like to pick a topic that I think is pertinent, and then I'll ask the students if they have a topic in mind as well that I'll bring a guest speaker in on. But topics usually are related to diabetes, heart disease, diet, inflammation, the microbiome. This past class, our topic was all about obesity and understanding diet is not just calories in versus calories out, and helping them understand weight loss. We got into some nitty gritty with the endocrine system and things that they might not have thought about since biochem. In monthly class, we also do practice exams because, well, what does this matter if you don't pass your exam, right? So we do a lot of practice exams in class, and I'll usually bring in a guest speaker, one or two. Our past class was the director of pharmacy here, and she taught a class on food-drug interactions. So we usually have a speaker, practice exams, and a topic that relates to something current going on in nutrition. So we do meet for class monthly. So what sets us apart from other internship programs? I think primarily because we have a small class size. I accept 9 maximum. We are part-time, so that allows our students to be working on a master's or have a job or both. The rotation choices are fairly flexible. I create a schedule that you all saw, so I create a schedule, but with that said, some of the rotations are not competency-based, they're just exposure-based, just to give you an idea of what happens at WIC or what happens in sports nutrition. It's not necessarily a competency rotation. So if a student knows exactly what they want to do, I can help them get more rotations in that area of interest. So we are fairly flexible, and that's only possible because we're small. if I had 40 students, I couldn't do that. But because we have 9, I can be really flexible in helping them find rotations that are really suited to their interests and goals. We've got a lot of rotation options, and we use class time to just explore more nutrition topics and get into nutrition a little bit deeper. So with that said, I would love to allow Carolyn, who's one of our current interns, jump on for a minute and tell you a little bit about what it's like to be an intern, if there's anything that is different from what she expected. I'll let Carolyn chat for a minute.
Hey everyone, I'm Carolyn, LSU grad and current intern. So I would say, first of all, it's a lot different than I expected, but in a good way. I didn't expect it to be like as hands-on with the patient care and everything. So for me, that's been very enjoyable. I'm interested in clinical, so being able to actually see patients and do a lot more than I thought I would be able to do has been awesome. I spent my first 10 weeks at North Oaks doing my clinical rotations there. And then this past rotation, I went to University Medical Center in New Orleans, and I got to see the burn unit. So that was really awesome. It was good to see how other dietitians at different hospitals do things as well. The burn unit was not what I was expecting. It was very nice, no bad smell. So that's a good thing. Then this week, tomorrow, actually, I'll start my food service rotation at North Oaks. So kind of excited about that. We'll see how it goes. But yeah, overall, it's been such a great experience. Having class once a month is a great way to stay connected with the other interns that you don't see. And you get to have a one-on-one with Leslie after each class. So that's really nice to be able to talk to her about anything that's going on, or, you know, kind of your goals and stuff for the future. So yeah, it's just a really great experience and even better than I could imagine. So
thank you, Carolyn. Yeah, I think that's one thing most of the interns tell me when they come in, is that they didn't know that they were going to actually be seeing patients and charting on patients. So you have a login to our electronic medical records. You are seeing the patient, you are charting on the patient. You have a dietitian that's co-signing behind you and helping you along the way, but it's not just observation, it's supervised practice. So you really are hands-on day one. I mean, we get you right in there with lots of supervision and lots of help, but it's not a lot of just sitting around and observing. We want you to do it. And I think that that's different than what most people expect coming into an internship.
Since we have some students live with us, I'm going to open the floor to them to see what questions they have before I get into my questions.
The rotations each week, is it always like Monday, Wednesday, Friday, or does it vary per week per different rotations?
That's a really good question. It depends on the preceptor, and it does vary depending on the preceptor. So for example, if you're going to Veterans General for their outpatient, they only hold clinic on certain days. So they only want interns on Monday and Wednesday. So I can really only send you there on Monday and Wednesday. So some rotations are going to have to vary depending on what the preceptor is doing. What I tell the students is you want to contact your preceptor at least 2 weeks prior to your start date with them and get a schedule. So for the most part, our students are going to know their schedule like month to month. You know where you're going to be, but as far as the actual days of that rotation, that's going to change depending on your preceptor. You just have to contact them and find out. With that said, and Carolyn might want to talk about this, they're all very flexible. We've all been interns at some point. They know you have jobs and lives and homework, and so for the most part, if you say, look, my boss really wants me to work on Friday, well, okay, like we're here every day, so it's fine. I would say most of the rotations are extremely flexible.
Okay, thank you.
You're welcome.
yes, they're very acceptable with working with you. So, if you can't do a Monday or Tuesday, definitely just ask, and they're very flexible most of the time. So it usually works out.
I know some things have changed, of course, with COVID, but would you say it's back to normal, the rotations? Is that back to normal?
Yeah, I feel like because we're hospital-based, we never really were not back to normal. We're here, the hospital never closed. It was busier than ever. So, for the most part, we continued on business as usual. with the exception of the dialysis centers. The dialysis centers are still not allowing, even the dietitians going in, they're all working virtually. So with the exception of that one rotation, we've been really business as usual almost the whole time.
I have a question that Carolyn might better be able to answer, but I don't know if you're getting your master's right now, but how has that worked out with y'all's program?
Carolyn, you're not working on your master's?
No,
Yeah.
I'm not getting mine right now.
Okay.
I have one student currently who is working on her master's. I've got two who already came in with it. She's working on a master's just with a online program, and because we're part-time, I don't think that it's been that challenging. Last year I had two students who were working on their master's at the same time. In the future, obviously, like every other program, we're going to have that as a requirement, but I'm kind of waiting until I have to, for is the best way I guess I can say it. So right now the master's is available. It is an option. I will work with the program that you're in to make sure that your rotation schedule aligns with your class schedule to make it all make sense. Like I know Peyton, who's getting her master's right now, we had class on Thursday. She's like, I have a test at such and such time. I'm like, well, go, what are you doing here? Go, take your test. So we work with you. We work with the master's coordinator to make sure that it all works out the way that it's meant to. Right now, it's not required for us, but it will be in the future.
Well, I can jump into my questions. Peyton kind of alluded to the COVID thing. So Leslie, what would you say is the best or the most major improvement to the program that's actually been born out of COVID?
For me, it's the decrease in hours requirement. Going from 1,200 hours to 1,000 hours is significant. It takes a ton of pressure off. Before that, if we had been put off and out of rotations for 2 weeks because of a hurricane, it would have been a major scramble to get everybody working overtime to get caught up. And now it was like, okay, well, we only have to get 1,000 hours. So that 2 weeks, unless it was a competency-based rotation that I absolutely have to make sure you get into, we can just move on. And so one of the things I've been able to do is look at some of our rotation sites that were in there. I don't want to call them filler rotations, but rotations that weren't necessary, rotations that were just an opportunity for you to get exposure to that kind of career in dietetics. I've been able to make them optional and say like, hey, if you're not really interested in sports nutrition and you don't want to be over here blending smoothies for 2 weeks, like, is there something else you want to do? Do you want to find a gastroenterologist that you can work under for 2 weeks, or things like that. We've been able to be really, really flexible because of that decrease in hours. It's just made everything just feel lighter and easier. And now if I have a student out with the flu, I don't have to panic and rearrange the whole schedule to make sure that they, fill those hours again, unless it was something absolutely dire. Like, I'm not going to let you miss trauma rounds. I'm not going to let you miss oncology. But if it was something that wasn't totally necessary, we can just move on.
All right, so looking ahead, what does your ideal class of interns look like? So thinking about like characteristics, personality, different experiences, what are you envisioning for future classes?
My current class is very ideal. I'm not just going to say that because Carolyn's with us, but, I've had great classes and I've had classes that were a little bit more of a challenge. And I will say that maturity matters. People who come in with a real passion for nutrition, not just someone who kind of fell into it and they graduated and they're like, well, I guess I need to do an internship. I don't know what else to do. The ones who are listening to podcasts in their free time and reading books in their free time and are really excited and passionate about nutrition and trying recipes, and they just have an excitement for the career and for the field, and diverse and motivated and mature. That's really what we're looking for. So, my current class, I've got some older students who are like, a second career. I've got some who are, right fresh out of undergrad. So everybody has their differences and they bring something different to the table. But the thing that they all have in common is just an excitement. They're just excited about every rotation. I mean, when we meet for class, they're like, tell me about this, tell me about that preceptor, how was it? And, they're just excited, and it's really contagious and fun to be around.
So to expand a little bit more on the diversity aspect, what are you currently trying to do to improve the diversity of the intern classes?
Historically, that has not been a problem for us just because we are part-time and relatively inexpensive. I get applications from all over the country, even international students, because of the part-time nature. It allows people to work, and we're not a super pricey program, so that's appealing to diverse populations. So it hasn't been a problem in the past. I will say we also have more of a holistic selection process. GPA isn't my number one selection criteria. We look at work history. Even if I see a student who's worked waited tables at the same restaurant for 2 years, well, that stands out to me as someone who is dedicated, motivated, knows how to deal with the public, knows how to follow through with commitments. I mean, that speaks a lot. And so it's not just always the students with the highest GPA, because they haven't had to necessarily work through school or balance other demands in their life. So we really do kind of have a more holistic selection criteria and process. And so that's been part of it. We do have some diversity training going on right now for our preceptors. Ascend and the Academy put out some webinars that I've asked the preceptors to participate with. And so we're trying to make sure that we are diverse and that we are sensitive to those populations, but it really hasn't in the past been a problem. We've had international students, we've had students from all over the country. I mean, even right now, I've got several, we're more like half and half are out of state. So it hasn't been a problem for us necessarily, I think, because we're part-time.
All right. So to think about diversity, equity, inclusion a little bit more, so you mentioned the training with the preceptors, but how are you implementing that information into what you're doing with the interns to improve their experience and to improve their ability to care for diverse clients?
We will, like I said, we have classes. So one class topic is going to be some diversity training from the Academy. So we will do that. We'll have a whole class dedicated to it. We also have a new rotation this year with it's a company that does telehealth for eating disorders with the LGBTQ community. So that is a new rotation that is available to the students just to be exposed to that population who's pretty underserved or underrecognized. So we've added that in, but yeah, we'll have a whole class dedicated to it. And then of course, our population, the students are tossed right in there with our demographic. Which is diverse. So we're in a rural area, we're in a low socioeconomic area, and they have to counsel. They have to counsel at the bedside inpatient, they have to work with the kitchen staff in the hospital, and they have to counsel in an outpatient setting. So they're tossed right in. So we'll have some inclusion and diversity training in class, but it's really the day-to-day hands-on that matters the most.
Okay, so I know with this new intern class, there's going to be changes with the new 2022 standards, but other than the CRDNs, what are some kind of additional skills-based training that you provide that you know that they really need? So that's why you throw it in there.
Sure. Well, this year we added the glucometer training. So they're working with the nurses to practice glucometers, and I think they all did okay with that. I didn't have anybody, problems with blood or anything. So they did glucometer training, blood pressure screenings. They're observing with our speech therapy team. So they're spending some time with one-on-one with the speech therapist to observe the video fluoroscopy and speech studies to see how the swallow actually takes place. When you get to actually watch it, it changes your whole perception. I think Carolyn's already had the opportunity to do that.
It was so cool. It was awesome.
So they do that with the speech therapist. They observe tube placements and NG tube placements at UMC. So they're getting to be a part of other care teams in the hospital, not just with the dietitians, but seeing how speech works and nursing works, and even some other protocols with the tube placements. So that's stuff that we have added in just this year. And then because I am so passionate about functional nutrition, we do a lot with functional nutrition. As far as guest speakers, we'll take a tour with a doctor in his clinic. And we do a little bit of functional nutrition in each of our classes just because it excites me, and I think that they don't learn it otherwise. So we do a little bit of that as well.
All right, I have a question for Carolyn. So thinking back to the many discussions you and I have had over the last year and a half about applying to internships, what would you say now, well, hindsight? So now that you're in the internship, what would you say were some of the best experiences that you had as an undergrad that set you up well to be a successful intern now?
So first of all, I'm not just saying this because you're our host, but definitely Dr. McKinley's classes were for me probably the most beneficial. I would say I didn't really feel confident in myself as a dietitian or a future dietitian until probably senior year. So really all of the classes that we worked on, like preparing our personal statements and just really learning how to actually talk and to make a resume and apply for internships, that's what I feel like prepared me the most. So looking back, take advantage of those resources that you have. Go talk to Dr. McKinley, any questions you have. Reach out to internship directors too. If you have any questions, reach out to them. Future or other interns that you may know, ask them questions. Talking is the best way to find out. So I would say looking back, that's definitely, what helped me the most get to where I am.
I'll just second really quickly what Carolyn said. If you guys are interested in our program or whatever program you're interested in, I really do encourage you to reach out to me if you're interested in here or whatever program director at the site that you're really excited to go to. It makes a big difference. We get a lot of applications, and if I can put a face with that application and be like, oh yeah, she called me, we did a Zoom meeting, or she came here because she wanted to tour the hospital, that really does stand out. And even if your application maybe would have been like middle of the pack, I'm going to remember you. And then it kind of does float back up to the top a little bit, because it takes a lot of initiative to step out of your comfort zone and reach out and call a director or send an email to a director. It just shows that, I'm going to have you reaching out and calling preceptors, and I want to know that you can do that. And you can show up and make a great first impression. And so I encourage y'all, reach out. If it's not here that you end up applying, wherever it is, it does help really tremendously to go ahead and make a first contact with that program director.
All right, to close us out, just like your first episode, I would love for both you, Leslie and Carolyn, to give us a quick little take-home message for potential applicants.
The take-home message is, don't be afraid. You are ready for this. You can do this. You are prepared. And what you don't know, we will teach you. So we're not expecting you to come into this and be the dietitian. We're here to teach you how to do that. We will take baby steps to that process. So we're going to hold your hand every step of the way. Don't be afraid. You know more than you think you know. And what you don't know, that's what we're here for, is to teach you and prepare you to be amazing dietitians at the end of this process.
I definitely second what Leslie said. I remember first day of orientation, I was like, whoa, I know nothing. But I promise you, you know a lot more than you think, and they help you a lot. And that's what the internship is there for, to learn. But just be confident in yourself, be confident in your abilities, and believe in yourself, and you'll get there.
Thank you, Leslie and Carolyn, for joining us on this episode and giving us an update on the North Oaks program. And for those at home who may be new to the podcast or new to the North Oaks program, please check out episode 5 to learn all about their program, as well as check out the website link that I've provided in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome dietetic internship. And we'll see you next time. Bye.